According to research, persons with a high omega-3 index are less likely to die from COVID-19. A pilot research found that those suffering with COVID-19 had better results. The Fatty Acid Research Institute (FARI) and partners at Cedars-Sinai Medical Center in Los Angeles and Orange County, California, presented the first direct evidence that greater omega-3 blood levels may lower the risk of mortality from COVID-19 infection. On January 20, 2021, the research was published in the journal Prostaglandins, Leukotrienes, and Essential Fatty Acids. This study comprised 100 COVID-19 patients who had been admitted to the hospital and had entrance blood samples saved. Clinical results for these individuals were acquired, and blood was tested at OmegaQuant Analytics for the omega-3 index, O3I, red blood cell membrane EPA+DHA levels, Sioux Falls, SD. 14 of the patients were killed. The 100 patients were divided into 4 quartiles based on their O3I, with 25% of the patients in each. There was 1 fatality in the top quartile, i.e., 1 death out of 25 patients with O3I greater than 5.7%, and 13 fatalities in the remaining patients, i.e., 13 deaths out of 75 patients with O3I 5.7%. While it did not meet standard statistical significance thresholds, this pilot study, together with multiple lines of evidence regarding the anti-inflammatory effects of EPA and DHA, strongly suggests that these nutritionally available marine fatty acids may help reduce the risk of adverse outcomes in COVID-19 patients. Larger research are unquestionably required to validate these preliminary findings, Arash Asher, MD, the study's principal author, said. Clemens von Schacke, MD, CEO, OmegaMetrix GmbH, Martinsried, Germany, and not participating in the study, agreed with Dr. Asher, cardiology researcher and co-developer of the omega-3 index with Dr. Harris. According to Asher et al., a low omega-3 index may be a powerful predictor of mortality from COVID-19. Although optimistic, these findings must be repeated. Omega-3 Teacher Drive. James H. O'Keefe, Jr., Director of Preventive Cardiology, St. Luke's Mid-America Heart Institute, Kansas City, Missouri, and not involved in the study, stated, a cytokine storm, or excessive inflammatory response, is a key mediator of severe COVID-19 disease. Omega-3 fatty acids, DHA and EPA, have powerful anti-inflammatory properties, and our preliminary investigation suggests that these fatty acids may reduce COVID-19's cytokine storm. The FARI research team is presently looking for funding to expand on their preliminary findings. Individuals and organizations interested in contributing to this study are urged to visit FARI's contribution page.